My name is Nancy Burke, and today I'm going to talk about female self-obtained swab in a clinic setting. I'm an RN. What we do in our clinic is we have express visits, and those are for patients that come in, they have no symptoms, and they would just like a screen for STIs. So as long as they have no symptoms, they would be eligible for an express visit at our clinic. So for the express visit, we would do blood work, which would consist of syphilis testing and HIV testing. And then we would do 2 self-obtained swab tests. One test would be for trichomonas, and one test would be for gonorrhea and chlamydia. So what we do is we bring a patient into the clinic room, and first I would obtain the blood, and then after that we would do the self-obtained swab. So the first swab that we would do comes like this. This is a NAT test, and that is for trichomonas. And I would get this, this vial ready for the patient, so I would take this out. This comes with a packet. It's a big swab, but we only use this if we do a pelvic exam and if it's needed for extra secretions before you would do the test for the trichomonas. So I would get the vial ready, put the sticker on the vial, and I would put this in the my little rack container that I would have in a normal clinic room. And then this would be the swab that you would use for the trichomonas test. And then I would get the NAT test ready for the gonorrhea and the chlamydia. And that's what this one is. And this consists of the vial. I'd put the sticker, the patient's name on there. And I would unscrew these tops and just leave the top on, ready for the, once the patient inserts the swab, and then the swab will be ready to go into these vials. And this vial would be in the rack also. So I would have those ready, and then I would have my 2 swabs ready here, okay? And I would just take peel this down just a little bit for that to be ready. Now the NAT test for the gonorrhea and the chlamydia, it comes with 2 swabs, dual swabs here. So you would use the Q-tip swab for the test. And this one you would either use for some other reason or just throw that out. So I have my 2 swabs ready and my 2 vials ready. So then I would, obviously be interacting with the patient. I would ask the patient to go, I'd pull the curtain, ask the patient to go behind the curtain, get my gloves on, and wash my hands, get my gloves on. And I would tell the patient to take pants and underwear down to her knees. And the best position is to bend your knees. And then I would tell her to insert the swab towards the small of her back into the vagina. And the first test that you want to do is the trichomonas test. And that's pretty important. They want that one done first. And I tell them to hold the swab past the red line, which is in the center of the swab, because that's where the perforation is and it might snap. So they hold it beyond that, and I tell them to insert it into the vagina. And when their hands hit the body, then stop and then rotate the swab into the vagina for 10 seconds. And then I will count for them either by a clock or my watch. And then once the 10 seconds is over, I ask them to take the swab out, give it back to me, and then I will take the top off. I keep this as a clean hand, and I put the swab into the vial here. Okay? And then we would go with the second swab. So I would hand them the second swab. And this has a black perforation. This one is for the gonorrhea and the chlamydia. And same thing, hold your hand below the perforated area, insert into the vagina, and then you're going to rotate this for 30 seconds. And I would count for them or time it on a clock or a watch. And then when that's done, ask them to hand it back to you. This is in a rack. It doesn't have a flat bottom, so I can't. So anyhow, this top was off. Clean hand, dirty hand, I inserted in here. So then I would take my dirty hand, snap off the perforated area, snap off half of that, and then snap this one off. Okay, and then I have the 2 vials, and then I take off my dirty hand glove, and then this one glove, and then I would put the tops on here, and then they're ready to be sent to the laboratory with the blood work. 5 tests: gonorrhea, chlamydia, trichomonas, syphilis, and HIV. Would be sent to the lab. They'll be back in 3 to 5 days. We would ask the patient if they'd like to know their results. They can call back in a week. Obviously, if anything comes back positive, we would contact them and have them come back for medicine or any type of treatment that they would need.